we also recognize people need something at home. So why don't you talk about that?
Yeah. So at home, you're not going to send a patient home with a tree in an IV bag, right? And so what you want to do is give them something that harnesses similar technology, and we utilize liposomes for that. Liposomes are cell membrane with the nutrients injected into the middle of them, and they don't require digestion. They passively diffuse across membranes into the bloodstream so that you can get the same style of a yield as you would with an IV bag.
So let me ask you this, because you know, we have doctors out there, they're going to have to explain this to patients, and you are very good at doing this. So when people, they'll say, well, I got vitamin C at home, I'll just take vitamin C.
Yeah.
Why would that, I mean, it's going to be helpful, but not as helpful as, say, liposomal or IV. Why would the hospital choose to do IV over a hard pill that people can just swallow?
That's right. So you have an off mechanism in your gut. You have the off switch. When your belly starts to experience larger amounts of vitamin C, which is over 1,500 milligrams, it will trigger a flushing mechanism, which means diarrhea. So your patients will say, oh, all I got to do is take 5 grams of this stuff a day. So they start downing the vitamin C, and they're they're sleeping in the bathtub because it's not an effective way to absorb it. So when you look at getting these nutrients into the body, make sure that these patients are getting frequent exposure, right, to slightly larger than normal amounts of things like vitamin C and glutathione, things that are going to upregulate that Th1 side of the immune system that boosts those white blood cells to be able to fight stronger and longer.
Right. Now, I take those same products myself, amongst others from your company, because of that liposomal delivery. And I've done a lot of research in nutrition over the years as well. Almost went that path in my career, but then my practice was so big, I couldn't continue down that path. But I'm very interested in functional medicine. So when I started talking to you years ago about liposomal delivery, I was like, okay, this guy really knows what he's talking about, way more than I did. So I started using your products, and I still use them. So there's a couple other products I wanted to ask you about. One of them is Biocidin.
Now, if you go to biocidin.com, not my company, I'm not affiliated with them. I'm just a clinician that finds a lot of value in what they do. Biocidin.com, they have a bunch of different variations of it. There's only one of them that I want you to think about in this instance for the absorption rates. It's called Biocidin LSF. It's Biocidin wrapped in the same liposomal technology that we just talked about for vitamin C and glutathione. The absorption rates are massive. It doesn't get destroyed in your gut, and we don't want it in your gut. We want it to be in your bloodstream so it can get taken to places like your lungs.
So tell us about monolaurin.
Monolaurin does a very similar aspect. Monolaurin, there are a couple of different companies out there that I like. And again, just as a clinician, I'm just going to give it to you, my opinion. Lauracidin is a company that additionally, what I was going to say, Doc, is those 3 bullet points that we talked about for optimizing the immune system with these nutrients, right? 1, concentrate the forces. 2, enhance the immune activity.
Yeah.
Right? And that's what we're talking about with these nutrients right now.
Yes.
And then the 3rd one is bust the films. And that's what we're talking about, Biocidin and
Biocidin monolaurin.
Yeah.